Brain fog is tough. We're talking about decreased concentration, a sense of fogginess or haziness, decrease in memory, decrease in the ability to think, almost like a cognitive dysfunction, decreased focus, not being able to focus properly, sometimes even confusion. And it really can make your day, your life so tough. So this video is dedicated to talking about brain fog, what we know about it, how to prevent it, what causes it, and how to potentially treat it. Guys, I'm Dr. Jen. It's good to see you. Now, let's first start talking about what causes it, because the cause is going to weigh into the prevention and the treatment. And this is the thing. The causes can be literally numerous. If you haven't gotten enough sleep at night or many nights of repeated not getting enough sleep, literally can cause you to feel foggy and not well. Brain fog absolutely can happen. Depression and anxiety can absolutely cause brain fog. Certain medications, I know I've done videos on, say, Benadryl, antihistamines, and some others. I'll link that here. When I take Benadryl or an antihistamine the next morning, I feel so foggy. And by the way, write in the comments if you ever get brain fog with any of the things I'm mentioning or anything else. But poor nutrition. I've had patients who say are on very restricted diets. I've had patients who say try the keto diet and it just doesn't, it doesn't work well for them. They don't feel good on it. Or other diets, they feel foggy and fuzzy in the head. But stress can do it too, all right? Just being stressed alone. Long COVID, all right? Long COVID patients, and let me know if you're a long COVID patient. Many of my long COVID patients feel like one of the symptoms they have is like a brain fogginess. They just don't feel the same in the head. Some other conditions that are notorious for this, though, are fibromyalgia and things like chronic fatigue syndrome and other things like that as well. So keep that in mind. But you can also get brain fog after an illness. You can get it during cancer treatments, certain therapies, whether it's chemotherapy treatment or others. It can also happen when there are certain changes in your body, like if your blood sugar goes too low or your blood pressure goes too low, can absolutely cause a haziness feeling, blah, 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 blah. Hormonal changes can also do it. Lots of things can cause you to feel hazy, foggy, decreased focus, decreased concentration, forgetful, memory issues, inability to focus, etc. Okay? Before we get to treatment, let's talk about prevention. Brain fog is not something that we're always solely in control of, but let's go to treatment, because sometimes helping the things that can help brain fog are some of the things that may, in some cases, help us prevent it, if it can be prevented for some of us. Let's talk about sleep, okay? Making sure that you're getting a good night's sleep is so important. It's not only important for your body and your mind, but also preventing things potentially like brain fog and other things like that. And for you, it might be that making sure that you're getting a regular sleep schedule, etc., may help you prevent brain fog altogether. The other thing is you may need to sort of review your medications with your doctors. I have lots of videos on some medication side effects. I do not believe medications are bad. Medications are simply right for some and not right for others. And we have to remember that there's almost nothing in this world that doesn't have potential side effects, medications included. So you want to review your meds with your doctor, because if something's not making you feel right, if you can find that, you might be able to isolate it, change things around, switch things, and might feel better with that, okay? The other thing is, if you're able to get the underlying condition treated, that is ideal, right? Because I've mentioned many conditions that can cause brain fog, but there are some behavioral things that you can do. If you feel like you've got brain fog, do what you need to do to get by. That might mean taking notes, making reminders, having reminders set throughout the day so that you can get through your day and make sure that you're getting through your tasks. Other things is pace yourself and take breaks. You don't have to be Superman or Wonder Woman. Do and sort of accommodate yourself as you need. Make sure that you're listening to your body, and don't ever hesitate to get a therapist involved. Cognitive behavioral therapy can be very helpful with things like brain fog and some of the other symptoms you may experience, because honestly, they can be quite distressing. Remember, you're not alone if you experience brain fog. Also, remember, it can be caused by lots of things, many of which may not be in your control. It's important to do the best you can, give yourself some grace, and make sure you're working with your doctor. Let me know in the comments if this was helpful and what you do, because often what you do helps other people. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Please subscribe to my channel. Follow me on Facebook. Subscribe on YouTube. I'm on TikTok, Instagram, LinkedIn, WhatsApp, Threads, you name it. And please go to drjencaudle.com to sign up for my free health newsletter. Guys, I'm Dr. Jen.